Hello, and welcome to the HIV Interview and Conversation series with me, your host, Charity Kase. The COVID-19 pandemic has had a profound effect on many people living with HIV. For those who lived through or were diagnosed with HIV in the 80s and 90s, the past 18 months has had a horribly familiar echo to those early days of the AIDS pandemic. Today, I'm talking to Warren O'Meara in Alabama. Welcome, Warren.
Thank you so much for the warm welcome, Charity.
Hello, how are you doing? It's lovely to chat with you today.
I'm excited. I'm excited to be able to have an international friend to be able to talk about this very important topic.
Well, I'm very excited to talk to you as well. My first question for you is going to be, why did you decide to take part in the HIV Interview series?
It's very simple for me. Coming from a rural community, particularly in the deep south of the United States, not many people are in position to be able to be face forward for their HIV diagnosis, just because of a lot of the religious stigma, a lot of the communal stigma, a lot of the societal stigma that goes with a diagnosis in this country, but very specifically for a person of color, a Black male who is of the church experience in the past. It's even more taboo for someone to be able to show themselves with their HIV diagnosis, because as we know, many of our theologians will tell us that sex before marriage is not a good thing, right? Whether it's before or after, even at that point, people who have a religious affiliation or a religious background typically shy away from the ability to be able to show themselves as HIV positive role models. And so because I knew as a person of leadership in the church that was the case, given my own personal experience, I thought it no other way but to show folks that you can still be whole, healthy, and still believe, even as an HIV positive person.
And it's you know, I've this is the third conversation now I've had. You're the fourth amazing activist from around the world I've spoken to. And it's always been the same answer, and it's the same answer for me as well. You know, it's all about representation of different types of people living with the virus and thriving with the virus today, living happily and healthily with the virus. And I think the more different types and examples of happy, healthy people we have in the world showing their face and telling their story, the more we're fighting stigma. So thank you from me for doing your bit.
And thank you from me for showing up and showing out in a great way for us as well, because to your point, we do need many of us being able to show that it's just not one dichotomy that is HIV positive. It's not one country where it affects a certain group of people, but it's many faces, many people, many countries that this disease unfortunately still exists and is growing in some cases. So it's important for all of us as ambassadors, as thought leaders, as people who are willing to be face forward and be in view, if you will, to do so that other people will understand that they can thrive, they can live, they can move, just as they normally would have if they didn't happen to find out that one moment they had one more thing to live with.
100%. And also there's, like you say, there's so many different stereotypes of people that are living with the virus that don't ring true. And not only that, but you know, there's also social prejudices and injustices that ring true and only elevate the stigma and the discrimination that goes on with the virus. So yeah, I think it's really important that we use our voices and show our faces. Definitely, it's the least we can do.
That's right.
As the people that are comfortable and confident, then you know, I think more people should be doing it.
I agree, because as you think about it, you know, we stand on the shoulders of many who didn't get the opportunity that we have for advancement, even after 40 years, right? And so we are indebted to those who did unfortunately have a death sentence as their moment when they learned of their diagnosis. And so I think, you know, in part of why I do what I do is I know that many people died so that I have the right, to be able to show my face, to be able to stand up for others that just did not, for many reasons, did not have the opportunity that I've been afforded to be able to have this voice. And so I want to be the voice for them as well as a voice for myself.
And that's such a massive, massive part of World AIDS Day. You know, that's remembering and honoring the people who died before us. and helped us get to where we are today. And also supporting those people who are living with HIV today. And,
absolutely.
You know, when I spoke about my story on TV, it was overwhelming the amount of messages I got from people who had lost friends or family members or, you know, loved ones during the crisis, who were overwhelmed and so joyful to see me living to my fullest now with the virus. So yeah, I mean, if only for those people, it's important that we show up. Never mind for the people who need representation like us here today. Okay, Absolutely. Well, now we've had this conversation. My first actual question. Tell us, how does it feel as someone living with HIV to be living through a new pandemic 40 years on? What parallels have you drawn between the early days of the COVID pandemic in 2020 and the HIV pandemic in the 80s?
It's a good question.
I'm not. You were very young when the HIV pandemic started, but this is then by no means me pointing a finger and calling you an age. Please don't take it.
Well, I'm a loud and proud 45-year-old. I have no problem telling folks how old I am, right? Fortunate enough to get here because at 33, I wasn't supposed to be, right? I learned of my diagnosis on November 2nd, 2009. And I was only given 8 days to live. So I have never got a problem telling someone how old I am because I've overcome even what my providers thought was possible for me. And I think in part because I was born for this work, right? Yeah. So the parallels that I would mention is that one, we have to call a thing a thing. We are having two parallel pandemics, right? We don't really talk about the HIV epidemic as a pandemic, but it's just that. It's a global pandemic, and it has been for 40 plus years, right? But the parallels that I draw is that many people I've witnessed and have had to be counseled for, have felt a sense of isolation similar to what happened in the early 80s of the epidemic, because of the unknown. Because of fear, because of many things. But what I will say that I appreciate, having lived through the second pandemic, is that we've learned a lot of lessons from the HIV pandemic, right? That we were able to get to the advancements of some sort of vaccine quicker because of some of the research that we already had on and in the pipeline for and from the HIV pandemic. And I think also I've learned that people went back to a sense of family during this secondary pandemic, as we did for those of us most affected by the HIV pandemic. People drew closer because they were the only ones they could relate to, right? And the world, I think, has seen through this COVID-19 pandemic that familiar, whether chosen or biological, circles are important to all of our health, right? Yeah. Having people that you can count on, talk to through the unknown, through fear, is what's really important to the strength of being able to make it through something that you really can't predict what the outcome might be.
Yeah, I mean, I think you're right. I think there's been so much growth in terms of medication and science since then, and also growth in terms of attitudes of the public. I think I'm not saying totally, because there's been lots of correlations that I've seen. I wasn't alive during the 80s in the HIV pandemic, but I've seen countless adverts, countless articles during my own personal research, and some of the terms and the language that we used back then that were taken forwards and used now. I'm not going to put out specific instances, but obviously the AIDS crisis was called the gay virus. Now there's been the COVID-19 pandemic has been called the something virus, with lots of different offensive, racist, and prejudice prefixes, and I think that in itself I found quite triggering. So I can only imagine how somebody who experienced the full-on stigma in the 80s, who lost friends or lost partners, would have felt seeing that and seeing the exact correlation between that and the public negativity, the public violence,
right,
going towards certain people and certain groups, Asian people, for
Mm-hmm.
example,
Mm-hmm.
during the COVID pandemic.
Mm-hmm.
It's very similar to what happened in the 80s in a lot of ways. And I think that we've got a long way to go when it comes to public attitudes to these things.
And I think a lot of it's based on our universal and our global human experience, right?
Yes.
We fear things that we don't understand. We fear folk that we don't understand, and we fear situations that we can't process. And so our natural, in some cases, instinct is to lash out at those things, right? I'm being from the US in the Deep South, racism is something that's just unfortunately ingrained in our society, and that we're still
and not just that.
right. But I speak on that experience.
Yeah,
because
100%. I mean, yeah.
In this country, I draw the correlation of racism because politically we've weaponized the pandemic in that regard through racist tendencies and through racist eyes, right? Many have attributed the response to our U.S. COVID pandemic to the fact that there's a woman of color now in leadership in this country. It's ridiculous to think that someone would place the blame at the feet of someone who inherited a pandemic, didn't create one, and inherited a non-response to a pandemic and is trying to fix it, but I see those as a person of color, I see those things happen all the time. And as a person who works in public health, more often than not, the first thing we want to draw a parallel to in any outbreak of any kind of health disparity is generally based on one's gender, race, or their identity. And it's sad to say, but that's the human experience that we've come to know in my 45 years, at least, anyway. Yeah,
I mean, well, I can't say that I know any different if I'm going to be honest with you. And I think that's kind of my point. That's what I was trying to get at in a much more eloquent way. These correlations and these similarities ring true to problems with our society that are deeper than just this conversation, that are deeper than just the changing of the adverts, be it going from being that horrendous fear-mongering damaging thing to being an educational thing, which is what it is now. Even with those steps, we still hold some of those prejudices as a society. So can you tell us a little bit more about what it's like living with HIV today in 2021?
Yeah, I mean, my experience is obviously different for many of my peers, particularly because it was the epitome of a journey for me spiritually, of understanding what my life's purpose was, what my life's mission work was, because it wasn't until I was diagnosed with HIV that a wilderness, in quotes, period I had been going through for about 5 to 7 years in my spiritual journey as a spiritual leader became crystal clear. Like in the moment, the universe spoke to me and said everything that I had been looking for. And it was in that moment that I declared to my providers, I will be the medical miracle that you all went to school to study. And that was done under sedation, under, medication and all of that from my hospital bed. I knew that the work that I had been working towards in my career led up to that moment, right? I had all of the development material at my fingertips to be able to begin the foundation that is now the 652 Project Foundation in that moment. And the only missing piece of it was learning what time I was born, which is where the 652 comes into play in the name of the organization that was founded by me. I learned at that point that I was born at 6:52 in the morning. And so that was the completion of all of it. And from that day, we began the process that's now fortunately been around for 12 years.
Wow. Well, I think that your story is amazing and it's very impressive. I think I feel like I relate to you in a lot of ways with you saying that it was kind of an eye-opening and enlightening experience for you. It was an enlightening experience for me in a lot of ways. And, you know, before I was diagnosed, I didn't really see myself going in any direction. And, you know, my coping mechanisms from being diagnosed have led to me being this monstrosity that's sat here in front of you today, who is using their voice for everything that I can see that I can possibly do, from going off my experiences and the people that I know, to change the world for the better. And yeah, so I'm almost grateful for my life experiences, because without them I wouldn't be who I am today. And so yeah, I relate to you very hard with that. And I think that there's probably a lot of people out there who have similar feelings, a lot of HIV positive people who have similar feelings. But yeah, our stories aren't necessarily sang very loud within the media. And that's the problem. Today, do you still experience stigma and discrimination in the same way that many did in the 80s and the 90s?
That's a really difficult question. It's one of those that I always draw a challenge for, because honestly, I didn't live with the diagnosis in the 80s or the 90s for that matter, because mine didn't come until 2009. And so I try not to ever say that I've experienced stigma in the same way. What I can say is that, yes, my diagnosis has been a weapon used against me. In many of things that I've done in my career. When I ran for public office for the first time, for example, my opponent chose to use my diagnosis as the weapon in a small rural town of how and why people shouldn't vote for me, because they didn't think I'd make it to the day that I could actually act as their elected official. It's been weaponized in church by my fellow clergy members and parishioners. It's been weaponized among my peers. You know, people have seen the success that have come with me and over years, and they've chosen to try to paint a different picture and paint me in a different light. So in that regard, yes, it's still a stigma that I have to face on a daily basis. And I have the moments, of course, like everyone else, where it gets to me. But more often than not, I always remember that this is greater than me. And even that feeling has much more meaning for the impact that can be made if I just persevere and push through. And so that's the motivation that I take with me, and hope that others will be able to take with them, that this is so much greater than the moment of uncomfort or discomfort that we may feel, because until there is a cure or until there's an end to this, no matter how hard we have to fight, we must.
Yeah, I mean, it's every single experience, every single negative, stigma-driven experience that I receive, I see as fuel. You know, it's genuine fuel. And I've come to a point myself where I've stopped blaming these individuals. You know, like if someone is to send me a horrible message, I feel such little resentment for that person nowadays, because my fingers aren't pointing at them. My fingers are pointing at the education system that was supposed to educate them.
Right.
Pointing at their friends and family that were supposed to educate them, their teachers, you know, the people around them, and society as a whole. And then in the bigger picture, the government for the education system, which didn't educate them. You know what I mean? And then
absolutely.
And then the bigger picture is society in general for electing a government that won't. So, you know, there's always a bigger fish to fry, and there's always a bigger person to point your finger to. So I think it's all about focusing and staying strong and sticking together as a community, and having conversations like these, which are so important.
I agree. I think, you know, we must, especially as outward people in view, hold our elected officials accountable, right? Because obviously laws mandate how we operate from day to day, as much as we may or may not like that. But we also have to hold each other accountable to making sure that the message that we're sharing is a parallel message, right? And not one that's antithetical because I don't like the way you deliver, or I don't like the way that your organization looks. I think until we become a universal voice of a message of hope, only then can we influence those outside influences to a point that we can get to the end of HIV in the way that we really should have already at this point.
Wow. Thank you very, very much for speaking to me today. It's been so lovely chatting to you and hearing your experiences and talking to you about your incredible life. I hope I get to chat with you very, very soon.
I'm looking forward to more.
I'm sure we will. I'll see you around. And thank you all for watching this series. It's been lovely chatting to all of my guests. And I hope you have learned something and are sharing it all with your friends and family. Do your part in changing the way the world views HIV. Thanks for watching.